Hi, I am Professor Banerjee. I am a public health specialist. I will be discussing a important public health problem and a hazard from a particular building material which has been banned in most countries of the world because of the health hazard, and that is asbestos. And I have got a paper. I have a very comprehensive paper on the asbestos hazard in our country and how the government of India has been responding to the concerns which have been expressed from time to time. Uh, and as on today, what is the Indian government position? Uh, the WHO had declared that all forms of asbestos can cause cancer, particularly lung cancer, then cancer of the linings of the lungs, peritoneum, cancer of the ovaries. It can also cause fibrosis of the lungs, which is called pneumoconiosis, which is an irreversible condition, and gradually the lung function gets compromised. And of course, lung cancer develops after some years. So it has been banned in most countries. So from time to time, there have been questions in parliament, and this is a very comprehensive paper, and which is well researched and which has used these exchanges which have taken place in parliament, the queries raised in parliament, the government responses, and the evidence for and against, and the explanations given by government from time to time. I will be putting this link in the description. You can read the full paper, and it's quite concerning. Because asbestos is been recognized as a health hazard, as I said, by WHO, and besides that, many studies in other countries, including our countries, have brought out the health risk. But still, the government of India has not banned, it has banned mining, all right, but it has not banned use of a particular type of asbestos. Asbestos also, there are six types or six or seven types. The different types are uh, crocodolite, anthophyllite, amositile, tremolite, actinolite, and one which is of relevance in our context is chrysotile, Chrysotile. Chrysotile is the type of asbestos which, in one international convention, which is mentioned as a Rotterdam Convention, which lists all the other types of asbestos, but it has not listed chrysotile. It has not listed. Maybe by oversight, maybe it really doesn't think that it is harmful, chrysotile. And based on this, in the annexure, it has not mentioned this type of asbestos, chrysotile, and this is a defense for those who wants to persist with the use of this asbestos, chrysotile. And WHO has said all types are harmful. It has not made any exclusion. And there is a very powerful lobby, and they have got a website, Association of Asbestos Cement Products, New Delhi. They have got the website, and they persist in mentioning that chrysotile is not having a health hazard against the so-called, I mean, they are overlooking the medical consensus now, except for one Rotterdam Convention, all other whatever guidelines are there in other countries, and even including the WHO, they say. So then some of the exchanges in parliament which are also recorded in this paper are that, of course, due to the pressure and due to government has stopped mining, mining in 2011. Mining of asbestos is not, they have not given license to new mines and they have not extended the license of earlier mines. But again, there have been one study on the basis of which there is a recommendation that it may reconsider of opening the mines. I mean, that is also the government of India will come to that. They had done a government of India commissioned a national study in occupational safety, health and working environment in asbestos cement products. So under the directions of and they found that evidence is not very strong uh, that it is harmful. But you see, if you do a uh, poor study, if you don't do a very exhaustive study, you may miss the. You see, they did a study among 50 factories which are using asbestos and among 2,603 workers, and they found only 10 cases of asbestos related health hazard. But actually, this type of rapid study is not giving the full answer because this cancer and all takes time to develop. So many of our workers, building construction, asbestos, they are in the unorganized sector. They are migrant workers. There is no monitoring of the health. At that point of time, they may be healthy, but the lung function, the fibrosis, the pneumoconias, asbestosis, lung condition is called asbestosis type of, the lung fibrous, it gets scarred. It can, and it gradually loses its function, lung function, and that takes some years. And they may just drop out and migrate somewhere else. And they are not poor people; they are not. They are exploited actually. And similarly, the cancer may develop after 20 years. So that is not the way to do a study and give a clean chit. So that is one. Other things, where are we getting our asbestos from if we are not mining? So we are importing, we are the major importers because most of the countries have stopped using asbestos. We are the major importers, and the bulk is coming from Russia, Kazakhstan, Brazil, China, and Canada. So there is a lot of money is involved, and it's a handy material. It is cheap, asbestos cement. Where all it is used in, yeah, must have seen garages and other the rooftops, asbestos, then asbestos pipes, asbestos cement pipes. They are used in brake linings. So all those workers who are working in this brake lining or servicing of these products, they are exposed to asbestos fibers. And government from time to time, it has said that the studies have been done, which says that if you take precautions, if you take personal protective, and if you do it in a wet process, there is so the aerosols, the fibers are not thrown in the air. They made some guidelines that there are some permissible limits are allowed. And then they found 50 factories they surveyed. They found 15 are not observing these precautions and they are high. Those factories which are observing these precautions like wet process or 35 factories were, and they found permissible limits. But these are under ideal conditions. We all know that in our country there is no supervision. There is uh, no inspection. And even 15 factories are not observing during the study also shows that appreciable numbers of people are exposed to asbestos fibers, which go into the lungs and cause the fibrosis and long-term cancer. So these are the countries we are importing. And there is, as I said, a lobby. So there are commercial interests. The profit is taking precedence over health. So this is something so and the present position is that. So then government has done some studies from time to time. You see, there have been studies done by, say, Association of Physicians. I'll be putting this, and some of the government rulings, government acts, government regulations, they are contradicting the government statement. Way back in 1952, according to the Mines Act, 1952, it recognizes all the diseases can be caused by asbestos. It gives a notifiable and it includes cancer of the lung and peritoneum and the pleura lining of the lungs. So it is under the Mines Act. Then this include asbestos and cancer of the lung. Then, as I said, WHO has been warned in 2011 when asked whether asbestos, despite being hazardous to patients and to all the workers, to the patients and environment, is being used by industries in the country, the Ministry of Health stated that as per parliamentary records, that the health risk of the use of chrys chrysotile, as I said, no, that's one type of asbestos out of 6, 7 types, chrysotile, were yet to be proven. He says there is no strong evidence that is harmful, whereas the WHO and all and the Mines Act also had stipulated. Then in 2005, a legislator voluntarily raised awareness about the health risk associated with asbestos by citing a study published by the Indian physicians in Parliament. The study concluded that asbestos in any form and under any circumstances is carcinogenic, cancer causing, and that there are no safe levels of exposure, a position supported by numerous international studies. You see, here, when we have to push something, we will take advantage of WHO guidelines. We will say WHO, we will say international consensus. So now here, when the whole evidence is going against asbestos, including chrysotile, government is just hanging on to a straw, saying ki nahi, there is no strong evidence. And even Indian studies done by Indian physicians, they found asbestos, all types are harmful. Still, the government is saying ki, as on the records, there is no proven evidence. I mean, the science has become mockery nowadays. That means it is just used as a weapon now, not unbiased, not without conflicts of interest. And again, in response, the government issued a rebuttal to the study of physicians of India. It issued a rebuttal that its agency, Indian Council of Medical Research, New Delhi, has found that there was no convincing evidence that consumers of asbestos products faced any significant risk of cancer. Come, look at is the ICMR is only become an arm of the government to give clean chit to anything, from vaccines to asbestos? Okay, vaccine may be debatable. It's new. We are still, but asbestos has been established. So now we and I mean, they should do long-term studies. You have to follow. Cancer takes 20 years, 10 years. Have they got on the record, ICM or any study where they are following up people who have worked with asbestos? As I said, you do any Saudi study, any rapid, and you clear it. So this is unfortunate. I mean, and it is not only the workers are at risk. You see, asbestos, you find asbestos are also used in old ship buildings and ship repairs. People working in the shipbuilding, then asbestos, if it is there in your asbestos pipes in your buildings and all, during demolition, there asbestos fibers are thrown up in the air, and it is inhaled by people living in such buildings where the demolishing is going on, where the repairs are going on, when they are breaking the roof or something, which are asbestos tiles. You have seen, they just throw it here and there, and there is a lot of dust and all. Asbestos dust is coming out, and you are inhaling. And have you seen any worker using face mask and all? I mean, respirator rather, face mask where asbestos fibers. Workers, they just work with asbestos, and they just, as I said, health hazard is not monitored. So this is, and you see, in 2009, Kerala government banned asbestos for rooftop in schools. You see, rooftop in schools, wear and tear and dust from the asbestos cracks. Because there was a point raised by Human Rights Commission. In 2009, Kerala banned use of asbestos in roofs in schools. And this was followed by Calcutta High Court, which banned use of construction asbestos use in court premises. court complexes. I don't know why the judge thinks only the court people are exposed to asbestos. It's the people. What about the common man? Schools and all. And then Central Pollution Control Board, Human Health Risk Assessment Studies in Asbestos-based industries in India. I had listed some of the studies. So government has been continuously defending the import, processing and use of asbestos against all medical evidence. In response to many studies in other countries, I have already mentioned, raise awareness about healthy study, Indian Association of Physicians, then human rights, Kerala banned in National Institute of Occupational Health, ICMR, National Institute of Occupational Health, ICMR declared no risk from asbestos, going against all the currents. In 2017, Environmental Ministry questioned about plans to ban asbestos. Environmental Minister in Parliament was asked. In response, cited wet process. So defense was given कि we can use wet process. गीला करके उसको ये करेंगे हम. For continued use, also widely used by masses. No? Masses are using it. Masses are using it, but it is your job to tell them the health risk. The masses, if the politicians and policymakers are ignorant, can you expect the masses to be? Despite a 2008 study conducted by Central Pollution Control Board. Central Pollution Board conducted a study which found that the title of the study was Human Health Risk in asbestos industries in India. It confirmed all forms of disease, including cancer, can be caused by asbestos. So, Central Pollution Board study, it confirmed, and it raised concerns about integrity and influence in other studies. So look. Then there are some public interest litigations, and then Factories Act 1948. As I said, there are some contradictions in the government acts and regulations. Special rules developed for asbestos in Factories Act. 2017, they made some permissible limits. कि इतना limit allowed है. Mining of asbestos was banned, not issuing. However, in 2013, Indian Bureau of Mines questioned on health effects had conducted a science and technology project study of pollution levels in asbestos mines and processing plants in Rajasthan, which recommended that restrictions as grant of renewal of license may be lifted subject to safeguards. So again, one good thing is they are banned it, but in 2013, some study done by Bureau of Mines said that with safeguards and all, this ban may be lifted. I mean, this is again, something is, the health is, there is when asbestos can cause serious diseases which are irreversible like pneumoconiasis and lung cancer, which is then it is better to be extra cautious rather than wait for very firm evidence. It is unethical to continue. As on today, I would say it is unethical to continue using asbestos. It is unethical to continue importing asbestos. So these all I had to say today. I will be putting the link, and I would request all citizens, and I am founder member of Universal Health Organization. We always, through my channel and through QWife channel, we always raise, which is a media partner, we always raise public health issues in public interest. And we do not take any, we do not have any conflict of interest, no any political agenda. And we are open to voluntary donation from common citizens. And I will be putting the link in the description, QR code. So it's up to you. I mean, we are quite comfortable with whatever little our needs are not much, but we like to do the research and convey and put on record, or basically we are functioning as a watchdog for public health. So that's all today. Thank you.